Now, we saw last year that NAB and our members at NAB were hurt by unhealthy workplace design and practices, and that's too often led to them resigning from their jobs, and in some cases far, far worse, with really, really serious impacts on their health and safety. Unreasonable workloads, caring managers, uncaring managers, constant workplace change, not to mention the gendered issues of pay and promotion, have all had a really serious impact on our members' wellbeing, and they all contribute to unhealthy workplaces. Today is the first step in a long campaign to address these issues, so I'd really like to thank all of you for being here with us today. I'm absolutely delighted to be joined by two incredible speakers today. We have Professor Maureen Dollard and Julia Angrisano. Julia, as many of you would know, is the FSU's National Secretary. She's worked with the FSU for many years and has a really deep passion for workplace health and safety. Professor Maureen Dollard is an Australian Research Council Laureate Fellow, Director of the PSC Observatory, University of South Australia, and Honorary Professor at the University of Nottingham. Her research concerns workplace psychosocial factors, and she has published 6 edited books and 200 papers and book chapters, and has been cited almost 17,000 times. Maureen is a board member of the International Commission on Occupational Health and is also on the editorial board for Work and Stress, the Journal of Organisational Behaviour, and the European Journal of Work and Organisational Psychology, and is a past foundation president of the Asia Pacific Academy for Psychosocial Factors at Work. Maureen is also a foundation member of her union, the National Tertiary Education Union, and has been an active member at the University of South Australia for almost 30 years. Her contributions on workplace mental health are foundational to our modern understanding of the impact that work can have on our lives, and she's been instrumental in working with the ACTU in developing the Mind Your Head campaign. We are absolutely delighted and really proud to welcome Professor Dollard today, and I'll hand over to you, Maureen. Thank you so much.
Thank you very much, Nicole. I'm delighted to be here and have this opportunity to talk about psychosocial factors at work. But I'm coming to you from the Kaurna lands, the Aboriginal people of the Adelaide Plains, and I pay my respects to elders past, present and future. Yeah, so I think that somebody has the slides, so I wonder if you could, I do have a bit of a slideshow, but I really tried hard not to have that many slides so that we could actually communicate and talk about stuff. So I'd be happy, if you put a message in the chat, and we can stop and discuss it. The idea is to try and let you know the kind of things that we've been looking at and what's really been occupying our time, and hopefully you can kind of resonates with you. You can see how maybe some of the work could be applied in your workplace, etc. But that photograph there is a photograph of my dad. And you can see way back, like he's standing right on top of a ladder slung over the top of a power, telegraph pole. And you can see the safety standards there were like pretty horrific. I mean, this just would not happen these days. And I like to sort of, it's incredible to see that. And you just sort of think, well, we have made some progress in work health and safety regulations over time. And just at the moment in Australia, there's really great progress in terms of regulations in relation to psychosocial factors at work, which I'll talk a little bit about as well. And I'm sure that you're across all of this stuff as well. But I'm really delighted to be able to talk to the union about these matters and the issues that are of concern to me. So the next slide. So I want to talk about psychosocial safety climate, which is, the safety climate, as in any kind of like high risk industry safety climate, what's the climate like for safety? But this is what's the climate like for psychosocial factors at work. And when we talk about psychosocial, what we mean is social factors that have psychological consequences. So the way your job is designed, the way your organization is structured, like who your management is, what kind of style they have. These are all psychosocial factors, and they can all be changed. Like nothing's fixed about a psychosocial factor. It's by human construction and can be modified. So this is the thing to keep in the head. And, it might seem like a bit tricky, psychosocial, but let's claim it. This is what it is. It's psychosocial. These are psychosocial factors that cause psychological damage. And that's what we have been really focusing on in my research group. And for short, it's just PSC. So from now on, I'll call it PSC, much easier to remember. But we're going to look at the evidence for why PSC should be used in organisations. As I'll look at some benchmark information. I'll look at some data from the finance sector that we collected last year. And I'll also look at how much an organisation could save if it shifted people from lower levels of PSC to higher levels. And, you know, I mean, we work in a neoliberal economy, and, you know, you might yearn for a revolution, but it's probably not going to happen in my lifetime. So therefore, we have to play a game of how do we draw the attention of management to this issue? We can throw some cost benefits towards them, and they get interested when you start talking about the costs to productivity when you run an organisation that's got low PSC. Okay, next one. So mental health at work, it's a global public good. You know, it's a fundamental human right for all people. And yet from 1990 to 2019, mental disorders internationally remain consistently in the top 10 leading causes of disease burden worldwide. And this, you know, there's could be a number of reasons for this, but it tends to suggest to me that medical approaches, which have been, you know, significantly how we deal with mental disorders, is to give medication, to give therapy, to give counselling. All these things don't really seem to be working that well. So, you know, we need to look at social determinants of mental health and look to the work context where people spend, you know, most of their living hours. Start to look at working conditions and how they relate to mental health. And there's some really, really great moves nationally. And I've been looking at this issue for over 20 years. And, you know, it went from the ACCI storming out of a presentation I was doing at a symposium run by Safe Work back in 2019 something. I can't remember which year. It was about 20 years ago, let's say. And they stormed out saying, you know, work stress is a myth, you know. I think they're at the table these days, and, you know, it's still a struggle with them, but, you know, things have changed, things have improved. We've had the Maureen Dollard report, which now the national government is going to take up, you know, almost all of the recommendations of that report. There were 18, I think, and they're going to take up 17. And psychosocial factors is one of the emphases in that report. There's been the Productivity Commission report about mental health, linking mental health to working conditions, and the Jenkins report. And the ACTU have been doing a really great job, I think, raising the public awareness of mental health at work and the factors that might contribute to it. So we're at a pretty good point in time, and especially now with the Labor government, there is, like in South Australia and nationally, for example, in Victoria, like, you know, when you've got that, there's, you know, ample opportunity, I think, for more regulations, guidance. You know, we should have the ear of the national policymakers. Next. So, you know, I do like graphs, so I hope bear with me. And, you know, I'll try and sort of explain some of them. We've been collecting data so we can make comparisons with international data sets. So this is Australian and European bullying rates. So the red lines is Australia. So you can see in 2014-15, 9.7% of the Australian workplace employees were reporting bullying. And then in 2021, it actually went down. So 8.6% of Australian employees were saying that they have been bullied at work in the last 6 months. So, you know, a slight improvement, but internationally, we don't look that good in terms of how we're managing. This is just one aspect, but it's one that, you know, always is being reported by you know, the regulators, you know, as evidence of psychosocial factors, but you and I know that there are many, many other ones. Okay, next slide. So psychosocial safety climate refers to the corporate climate for worker psychological health and safety. So what's the corporate climate like for worker psychological health and safety? And it concerns the policies, practices and procedures related to worker psychological health and safety in the workplace. And if you really think about it, it assesses the psychosocial management system. So when we assess psychosocial safety climate, we're really measuring how the organisation deals with psychosocial factors and mental health. It's a system, like we're looking at the system. Next. So these are all the questions that would be in a psychosocial safety climate questionnaire. There's 12 items, and you can see the 4 domains like management commitment, management priority, organisational communication, organisational participation. So they're all the elements of psychosocial safety climate. And then we ask questions in each of those areas. So it's really about, you know, like a top-down, bottom-up approach, a systems approach to what's going on in organisations. And, you know, so management commitment, for example, senior management shows support for stress prevention through involvement and commitment. Management priority, I like this one in particular. Senior management considers psychological health to be as important as productivity. And, you know, we're always like being pressed to work harder, you know, and they have these like stretch targets. You know, that sends a message that management might be more concerned about profit and productivity rather than your psychological health and well-being if you can't cope with those additional demands. And communication is, you know, like what's the system like for being able to communicate back to the organisation when there is an issue, for example, and participation. You know, are employees encouraged to become involved in resolving work health and safety issues that relate to psychological health? Are the unions involved? Are there health and safety representatives involved? All of these things. So I think that you would be looking at that going, yeah, I think these things are important. And I'll show you how important they are. Next. So if we look on this slide, you see over here on the left-hand side, psychosocial safety climate, right? And you can see the 4 domains that I just mentioned. What we found out in our research is if we measure that, we can predict future job demands, future mental health status, and health outcomes like absenteeism, injuries, workers' compensation. So knowing about psychosocial safety climate, we can predict all these future things. And then down the bottom, if you know about psychosocial safety climate, you can predict what kind of job resources might come in the future, levels of work engagement, and motivational outcomes like job satisfaction, intention to leave, work performance. So across the top, that's like a health erosion path. If the psychosocial safety climate is low, it probably means that management don't really care so much about the work pressure that you're under. They don't really care about the bullying and harassment that's going on. And that in turn leads to psychological health problems and so on. So in a kind of like an erosion process. But down the bottom is like a motivation process. So the higher the levels of psychosocial safety climate, the greater the levels of resources that are going to come, more job control, more procedural justice, the greater the engagement. And so you've got this model where you've got like health and, you know, engagement. And so organizations like this, because you're not only just talking about the health, but you're talking about performance and productivity at work. You know, that's how it kind of works out. So the point about this is that down the bottom, you see primary prevention, secondary intervention, and tertiary. The problem is that we've been focusing on fixing the problems at the end, like trying to fix absenteeism and workers' compensation by collecting data about workers' compensation instead of collecting data about the psychosocial safety climate of organisations. Because if you wanted to do something to stop all those other problems, you'd start at the top of the cliff. And that's what we say about psychosocial safety climate. When if you bothered to read anything about work stress, usually the theories start with job demands and resources. They say the reason you're stressed is because you've got too many demands and not enough resources. But the question is, how come? How come? And if we go back, well, it's got something to do with the management values, the way that the organisation's being run, and the safety systems. So you go back, and then if you wanted to do something about it, you would try to improve the psychosocial safety climate. And you can, if you've got a good system, people would be able to report that the work pressure is too high, for example, and there'd be revisions, and so it would go around. Okay, next. So again, this is just another sort of visualization of it. You've got psychosocial safety climate as a leading indicator, and then you've got demands and resources. So it's a cause of the causes. So the causes are usually focused on the demands and the resources, but we say PSC is a cause of the causes. And then you can see all the other things down the line that happen if the psychosocial safety climate is low. You expect, worse outcomes. Okay, next. Yep, that's pretty self-explanatory. Yep. So we've been able to develop benchmarks for psychosocial safety climate, and this has proven to be really great to get organisations interested in trying to assess this. And it's probably not very pleasant for organisations to assess this, because the story might be bad, and then what do they do? But we've actually developed these benchmarks. So greater than 41, the organisation's performing well. Between 41 and 37, we need more actual enacting of the PSC principles, and so on. And at the very bottom, very high risk PSC, less than or equal to 26. Our colleagues from Germany did this for us. That they said they could see that there were dramatic increases in depressive periods and worsening job conditions when you were working in those sort of circumstances. So it really helps us understand, the status of the organisation and where to focus attention. Next. So for instance, so the Australian Workplace Barometer, if you look on the right-hand column, you can see the, the green, the colours, so obviously the top one, the green, is good. So this is Australian Workplace Barometer, national sample of Australian workers last year. 66% of them were in the green, which leaves X amount in the other areas that, that needs to be brought up to safe levels. What is it? 100 take 66. 34.
34.
Thank you. I'm having a brain drain. I have had
Trying
COVID.
to unmute for you, Maureen.
Thank you. Okay, stand by. More coming. In an Australian public sector agency, actually, it's a whole sector. 59% of the employees were saying that they were in the green. So you can see there's ample room for improvement. And then, we could do it for a particular organisation. We could show them where they stand. And this kind of benchmarking, it's pretty helpful for organisations to know where they are and where they need to improve. Next. So at the end of the survey, we might give feedback and say, this is how you're performing, and these are the areas that you need to focus on in those domains. Okay, next. And this would be like for the full 12 items, we'd give this sort of feedback, and organisations will work through that and figure out where they need to focus their attention. Okay, next. So at this stage, there's over 150 studies on psychosocial safety climate and how it relates to these other elements. globally, and yep, you can go ahead. So there's a number of different studies which show the benefits of improving psychosocial safety climate. One study that we had published last year in the British Medical Journal showed that if you've got poor psychosocial safety climate now, within 1 year, the risk of developing new chronic depressive symptoms, the risk increases by 200%. You're 3 times more likely to have depressive symptoms. So we took everyone out of the sample that was depressed, right? So we're starting with everyone at, average normal levels, and they developed chronic depressive symptoms within 1 year. That risk was 200%. So that's, pretty telling that PSC is a good benchmark for future mental health. And I'll leave these slides with you, but you can see all these other things. We would say this to management, if you increase PSC by 10%, you could expect, a 4.5 decrease in bullying, an 8% increase in job resources and so on. And where they get really interested is, the effects on sickness absence, a 43% reduction in sickness absence as a result of shifting people up, but keeping the sickness absence rate at the level of the green. So not taking everyone's sick leave away, but moving up. You can see that sickness absence varies by PSC level. I'll show you a little bit more about that. Okay, next. So this is a pretty interesting one. I'm sure the management are going to be interested in this one, but we asked the employees about the PSC, and then the supervisors rated the performance of the employees. And you can see this very nice line, which shows that as the performance of the person goes up, so they are reporting much higher levels of PSC on the left-hand column here. So, as the PSC increases, the performance also increases. You see this very nice positive line. So, there's good reasons why management should try to improve the psychosocial safety climate for the employees. Next. This slide is like the other ones, but it's just kind of turned around. So maybe you like this one better than the other ones, but it's got psychosocial safety climate at the top. And then on the left-hand side, it's got worker health. And these are all the various studies. It's only a few of the studies, but that show PSCs related to mental health. It's also related to physical health and MSDs. We've got information about that. It's related to sickness absence. It's related to workers' compensation claims. And on the other side, the motivational aspect, it's also related to engagement and productivity, integrity, or, anti-corruption behavior, anti-bullying and harassment behavior, and retention. So yeah, it's pretty amazing how many things it does relate to and does predict into the future. Next. You're probably very good with QR codes. So you could actually put your phone on that, and that'll take you to our website, stresscafe.com, where you can see all the different studies about psychosocial safety climate, and where they've been published. You might follow them up and see where what they've actually looked at. But yeah, that's what we've been doing, is trying to curate the data that's being built on this issue internationally. Okay, next. So why should we use PSC to measure mental health? So we try to steer away from actually measuring mental health, because as soon as you measure mental health, you've got, privacy problems, and, could you trust management to handle that sort of data sensitively and not cause more strife? But if we measure PSC, it's more about the system. So it's outside of the individual. It's about a system. And we tend to put, all the employees' perceptions together. So we don't just ask, in a work group, one individual and look at their perceptions of bullying. We actually aggregate it to the group level and then look at perceptions of individuals. So we look at like a cluster, it's a climate. So we really try to say this is outside the individual. Knowing about how the group sees psychosocial safety climate is going to be a good predictor for what happens in that group. It's beyond, an individual's perception. And that's really important because in this area, it's always been pretty easy to blame the employer if they are perceiving things like bullying. Now we can show that it's beyond their own individual perceptions. Okay, next. So we did this intervention study, and it's got PSC down the side there, psychosocial safety climate, and we did some surveys across 12 different public service agencies. And so from time 1 to time 2, it was 4 months, and time 2 to time 3 was another 4 months. As you can see, the black line is the group that got the intervention. So everyone got the survey, then they worked in groups together to develop an action plan, and then they implemented actions to try and improve the psychosocial safety climate. And you can see on the line there that the red is showing us what actually increased in that time. It was management priority. And really nicely, as the intervention started, the black line goes up, just like, okay, this intervention's working, right? And the control group, the dotted line, is kind of staying fairly flat. So this is looking like a good experiment, and you would expect these results. But at time 2 came the pandemic. So, oh, damn, what are we going to do? Because suddenly everything's, changed and there's a lot of instability. Well, what happened was, I think, if you remember, the management seemed to show a lot of concern and commitment to helping people at the time work from home. We're worried about your mental health. This is what you can do. Lots of big messages from the top level management about psychological health and well-being at work. And I think it was easy for them in a way because something else was to blame. It was the pandemic. But everyone could talk about it. Finally, we had the vocabulary by now to actually talk about these issues. But that meant that the control group got better as well, you see, because now the top management was saying these messages and it was affecting everybody, even the control group. So it's really, really good illustration that when top management really want to be committed to this, they can make some really good changes and improvements for the better. Okay, next. So I looked at the finance industry today to look at burnout levels, and I was pretty curious about this. This is data from last year, so it is in COVID, and you can see finance, insurance. You would say this is your sector, Alex, right? Yeah. Okay. So the red line is where you guys are, and so this indicates that burnout levels are, fairly high by comparison to other industry groups in Australia, right? So next slide. And now this doesn't kind of fit with my theory, so I'm a little bit distressed at this point. The psychosocial safety climate for the finance insurance industry is actually quite high. So high. So the highest score is personnel and other services, and then comes finance and insurance. So, maybe you've got a reason for why that would be the case. I'll show you the next slide. Next slide. So this is quite interesting because you see the burnout on the left-hand column, and then down the bottom you've got psychosocial safety climate. So, and you can see that most of the industries are lined up so that the line is like this. So the higher the burnout, the lower the PSC. Or the other way, the higher the PSC, the lower the burnout, right? So agriculture, forestry and industry have got, PSC of about 41, and they've got pretty low levels of burnout, right? As you see, they're all kind of... So there are two outliers here, finance and insurance, and personal and other services. So somehow or another, finance and insurance something funny is going on there. It's an outlier. Like all the other industries are in a kind of a line, a negative line, and then you've got finance and insurance. So I don't really know why. I'm not going to throw out my theory yet, because you would be expecting that if they've got such high levels of burnout, they should be a little bit further over to the left on PSC. They should be like over like where health and community services are actually, right? But somehow or another they're over here. So I don't know what that means. And if you can think about what it means, you know, what's going on there. It doesn't mean to say that every organization in finance and insurance is going really well. Obviously, there could be some that aren't. And in any case, we know from the benchmarks that even though the PSC could be quite high, there's variation. Not everyone is at that level, 45. There's going to be, that's only average. So there's going to be quite a few below that that need support. Okay, next. So yeah, this is the idea of how much money could you save in a company of, yeah, let's say 1,000, not 100,000, that's something else. A government agency of around 1,000 employees. So matching the corporate climate with unplanned sickness and psychological injury claims could save $1.18 million by moving workers to low-risk PSC. In that study of 1,000 employees, participants in the high-risk PSC work groups took 95% more unplanned leave than low-risk work groups. So you can really see the differences in the way employees behave depending on the PSC. And next one. And I'm not saying behavior in a sense like it's a negative thing. I'm saying this is what happens. So this is a private enterprise with about 5,000 employees. And you can see actually their psychosocial safety climate's pretty high. You know, actually 74% of their workers are above 41. But still, they could save almost $1 million if they shifted their everyone into the green. So still allowing for 4.68 days on average, you shifted those people up. You can study this later. It's quite hard on the head, but interesting. For example, you can see average sick leave, third in from the left. You can see as you go down that there's almost twice the rate of sickness absence in the red area. So there's good reason here why organizations should try to improve it. From a financial perspective, from a union perspective, people are suffering down here. That's evident from this information. Next. And we did the same kind of thing with employee turnover. And employee turnover, you could actually save $4 million for a company of 5,000 employees. You can see that the attrition rate increases as you go down the scale. Next. Yeah, so I mean, Victoria is leading the way, I think, in terms of the draft new regulations on psychosocial factors at work, which is really exciting. And you know, now looks like the national government is moving in that direction as well. So I think there's a lot of work now for the unions to try and establish their role in facilitating the implementation of the regulations, how that's going to work. But it's interesting, we were looking at some data from the European countries, and with one set of data, we could estimate the psychosocial safety climate in organisations. And then in another data set that we were asking experts about the extent to which there were national policy approaches to work health and safety for psychosocial factors along the bottom there. And you can see that, you know, you always look for patterns in the data. And this time it's like this, meaning that as the national policy approaches increase, which is along the bottom line, as that increases, so people in organisations are reporting that they are doing more about psychosocial stuff in the workplace. So 88% of organisations say that the reason they do work health and safety is because of legal requirements. So there is a good story here, I think, that strengthening the regulations is going to lead to more action in organisations to try and prevent psychosocial risks and hazards. Next. Yeah, so this is I think the second to last slide, so we're nearly done. And this is just to let you know what we're doing here. We got a really large grant from the Australian Research Council, which is really good to get funding from agencies for work health and safety research. Is, you know, it's not overly common. It would be better if I was a physicist studying black holes, or, you know, how to get my space rocket somewhere. I would attract more funding than work health and safety, I'm sure. But this is so we've established the Psychosocial Global Observatory. Our goal is to promote psychosocial safety climate, but also monitor it everywhere in the world, try and see what's going on by nation, so that we can maybe encourage some countries to do more about psychosocial factors. But we're looking at external drivers, so national policies, etc., of PSC, internal drivers, you know, about management support and commitment, feedback systems, real-time feedback systems, this sort of thing. Looking at employee assistance programs and how they can do more to help organisations, rather than just keep focusing on counselling individuals that fall out of the system and can't cope. You know, why don't employee assistance programs do more to try and build the psychosocial safety climate in organisations? So working with them, trying to develop a PSC index for ASX 300 companies, and then considering that any of the new and emerging risks in Industry 4.0 should have, you know, a human-centred approach to their implementation. And first and foremost, the psychosocial safety climate really needs to be considered in any kind of new implementation. So we can see how that fits with Industry 4.0 as well. And next. Yeah, so the takeaway message is to focus on modifying leading indicators. That PSC is a strong leading indicator for psychosocial risks and mental health. It enshrines worker participation. And one thing that we're doing with the ACTU and Mind Your Head campaign is they are training work health and safety representatives, so trying to build capability for those people. And then they are working with their organisations to do a PSC survey, bring this information to the table, develop collaborative action plans, and then implement them and then evaluate it. But the union, of course, is really trying to build the capabilities and build the, you know, the voice of the workers in this situation. And then finally, PSC should be a KPI for organisations. In the Victorian Public Service, it is already part of the minimum data standards. So my understanding is that every public sector agency needs to measure it. And I think that it should be written into the regulations. And so I am talking to Maureen Dollard about that and trying to get her to figure out how that could be done. I think I'm about 0.5 of the way there. But anyway, yeah, look, thanks very much. That's the last slide. So I think, is there one more to say thank you? Yeah, thank you very much for your time. I think you're doing a great job. If there's any work that we can do together, that's really fine. Yeah, it's exciting times, I think. Anyway, yeah.
Fantastic. Thank you so much, Maureen. Now I will hand over to Julia Angrisano, who is going to touch on our work with Mind Your Head, and we'll then have, I think, a brief period for question and answer.
Yes, Maureen, that was excellent. And as you were, taking us through the PSC, I couldn't help but think about the very high risk PSC profile that our sector operates in. And like you, I was a little bit surprised to see where we sat on the benchmark.
Yeah.
But, a range of issues were just running through my mind that our members have been talking to us about for a really long time that impact us in finance, really high workloads, excessive hours, unreasonable performance demands, that burnout that is very high makes a lot of sense to us. That definitely resonated with me when I saw that graph. But also, our members on the front line are facing customer aggression, really poor workplace relationships. And you did reference bullying and harassment specifically. And we have seen firsthand in our working closely with our members, kind of the very adverse impact that, bullying has on our members' mental health.
Yeah.
And that bullying graph, whilst, shocking in terms of where Australia is ranked internationally, again, that probably isn't very much of a surprise to many of us here today because, Maureen, you've seen this in your studies, but naming and shaming and other types of bullying tactics, which are really designed to just put as much pressure on workers, in our case, to sell products, not because customers need them, but because it's all about maximising the profits.
Yeah.
That has led to just toxic workplace cultures that we know are very unsafe and very, unhealthy workplaces. So thank you so much for this incredible research that you're doing and for designing these types of benchmarks that can really make a difference. So we will definitely keep in touch about how we might keep working together on that. And in a moment, I know we're going to have some questions in a moment, but, as we wrap up today, we are going to be launching our campaign because it is very much all about recognising the impact that the workplace itself has on workers' mental health. And we're going to kick that off in a moment. But just on Mind Your Head before the questions, it's an excellent program that I know South Australia seems to just be a powerhouse of super smart women who are really thinking about work health and safety, and the work that you're doing and partnering with the ACTU is something that we're currently assessing. What are the opportunities that we have to engage more directly with Mind Your Head? And we put forward some workplaces in Victoria where we know the Victorian government is backing that work, where we believe that running Mind Your Head would have a really significant difference. As you say, really just raising workers' voices in this space, improving the capabilities of the HSRs that we have on the ground. So I just wanted our members to know here that that's an area that we're also going to be doing in tandem with our big campaign launch. So thanks again, Maureen. I know we've got a few questions, and Nicole, do you want to facilitate any that come through the chat?
Yeah, I'm conscious of time, so I might just have to go to maybe 3 that I've had sent to me. So the first one touches on what you just said, Julia. The sector runs on targets and metrics. They usually involve sales targets of one kind or another. How does that impact on mental health?
Sorry, I didn't quite get the first part of that. Is it in the chat?
No, it was sent to me directly. So I'll just read it again.
Yeah.
The finance sector runs on targets and metrics.
Yeah.
They usually involve sales targets of one kind or another. So selling things to people who maybe don't need them. How does that impact on mental health?
Well, I know years ago they did away with kind of piece rates because workers work too hard. It's if this goes back to like rat studies, that had their rat in the Skinner box, and you could watch a rat, how the rat would behave. We don't do this sort of thing anymore, but they used to do this back in the day. And if you've got, targets and, you can reinforce incrementally with bonuses and things like that, that's going to drive people to work very hard, which might be what's happening here. High work pressure. Yeah, I mean, it's really terrible. I mean, because there's no end in sight. Just how much more could they go on? Every time the targets shift, right? So you never feel like you ever get there. Yeah,
absolutely. Thank you. Another question that we got was that along the lines of employers tend to, in our sector, focus on mental health from either an EAP perspective, just go see EAP if you've got a problem, and also we're going to have weekly pizza lunch, or we're going to have a tennis table in the foyer. These, go do some yoga or meditation if you're feeling stressed. How do you think those types of measures work in with like PSE assessments?
Yeah, well, do you remember that slide where I had sort of primary prevention and then tertiary prevention at the end, so what they're focusing on is like the tertiary kind of, the end game, like it's okay, we can keep you pretty stressed, but here are some things you can do. I think some of those things are not too bad. I mean, every now and again we do a bit of yoga here or a stretch, and that's, nice, but really we've got to focus on the upstream factors. And I think everyone sees like resilience training in a very cynical light. We would only talk about resilient organizations. If an organization is resilient, builds up stability platforms inside them so that when a shock comes, there are central mechanisms that can come into play that mean it's just not the individual's response to the situation. So I think these things are okay, but we need to be always really skeptical and cynical about why they're being introduced, and always fight for a stronger system, a stronger psychosocial safety climate. Yeah.
Great, thank you. And I think this will probably have to be our last question.
Yeah.
But our sector has moved very quickly a couple of years ago to predominantly working from home. Some of our members have had to stay in frontline roles during the pandemic, which had, in some cases, a really serious impact on their safety. But how do you think that, or what impacts do you think working from home has on people's health and safety?
Well, I think it's been good for a lot of people, and if there was trust between the employees and the management, it could continue. I think a lot of people miss the social interaction. Maybe we should just go to work for lunch and then go home again. I think that would be a good idea. But I think you really need to think about the human in this and try and figure out, at an individual level, actually what might suit. Because, people that have got families and, kids that, couldn't go to school and all that, they really needed to be supported at home. And they had a pretty tough time. So I think that we're probably going to see some sort of hybrid situation where people will work a bit from home and a bit at work. And I think, for environmental reasons, that's a really good idea as well, because, you're not using so much, transport and so on to get to work. Yeah, I think the literature is always pointing out pros and cons of working from home. There are some benefits and some detractors, and it's a matter of finding a balance that might be slightly different for different people.
Yeah, I think that individual approach is something that we're hearing from our members constantly, that everyone has different needs.
Yeah.
And the challenge for employers is to find a way to meet those individual needs and treat people like individual human beings. Now, we will be a little bit cheeky and just give you one last question, and that's to ask if you have any advice for us on how to talk to our colleagues at work about mental health.
Yeah, I like to try and normalize it as much as possible by and not being too frightened of it, but just to contextualize it, to always think that it's kind of no wonder that somebody might be feeling like this because of the working circumstances. I mean, it might not be the only thing, but it is a significant element in people's lives. And if you've been constantly under work pressure, your personal resources of energy are just going to go down. Your health is going to get eroded, if you remember that diagram. So yeah, I think not be frightened of it, but really look to the context. So if somebody is going to an EAP because they are depressed, I'm saying to the EAP, you should be assessing the psychosocial safety climate of that person to see what they're going back to. And so we did this study with the EAPs. We got everyone that was going to the EAP to fill out the psychosocial safety climate, and everyone that went to the EAP, their distress levels actually decreased. So they got better, but they got a lot better if they were going back to a high PSC context. So how good is an EAP if people are going back to the same circumstances? They've really got to put pressure on the EAPs to do more and to really do the work where it's needed, not just fixing up people as they fall off at the end. Yeah.
Great. Thank you so much. I will now hand over to Julia to launch our campaign.
Thanks, Nicole. Today we are launching our health and safety campaign, and really this is all about taking action to protect workplace mental health. And the first phase of this campaign is just about raising awareness and educating our members about these issues, and starting to develop and starting to use tools in the workplace that will start to address these issues. So the first thing we want you to do is to start with our self-assessment tool. We've already had more than 200 people complete the tool, and this tool is really important. It will help us, give us a snapshot of what's happening in your workplace, but also hopefully it'll give you an opportunity and a moment just to reflect on how your workplace can affect you from day to day and what we can do about those things. I believe the tool is being dropped, the link is being dropped in the chat in a moment. The next phase of today's campaign launch is really about launching our health commitment. And the other aspect of this is really just to allow our members access to important information. Signing up to the commitment means you'll get access to our newsletters and other communication channels that will keep you up to date with the campaign and our latest developments. So again, I really encourage everybody here today, sign up to the health commitment. Within the next month, we're going to be also launching our health and safety advocate roles. And this is a training course that will allow our members to gain further knowledge about workplace health and safety, as well as the tools that I mentioned earlier, tools that will help you to identify the issues that are the issues in your workplace, and the tools that you need to start resolving them. And so we're very excited for this. And as I said, we'll be launching this within the next month. So please sign up today. That will get you information for when we're launching the first of those health and safety advocate training courses. Finally, we're also going to be setting up a peer-to-peer support group, and that just gives our members an opportunity and an outlet to really discuss their week at work. What's been going on for them at work over the week and how that has affected them. It's just a really great opportunity to share your issues, talk with other members about how you're dealing with them, or just to share those problems. So if you've signed up as a to the health commitment, or if you've completed the self-assessment, we will be sending you some information about these peer-to-peer sessions. It really is the best way to stay in touch with what we're doing next in our health and safety space. You know, the very big employers in our sector have very real legal obligations to protect workers' health and safety, and this includes your mental health. And as we heard Maureen take us through, we've got some improved regulations coming, and those regulations absolutely recognise the effect and the impact of social risks and hazards that in the workplace. So we want to be ready. Our union wants to be ready to use these new laws, and this campaign really recognises the role that our union and our members can play in addressing the types of issues that we've addressed here today. Doing that self-assessment, signing up to the health commitment is about taking those first few steps, and really we want to see you all step up into becoming health and safety advocates as soon as we launch that training course. We want you to have the resources and the tools that can help you identify and address workplace mental health hazards. So thank you everybody for joining us today. It's been wonderful having you, Maureen, with us. Fascinating research. Look forward to an ongoing relationship with you. So thanks everybody for your time today. Have a good day.